Hi guys, how are you? How's everyone doing today? So welcome to today's session. I hope you enjoyed last week's where I was talking about ovulation and the impact that ovulation can have on your mood, particularly when it goes wrong if you're not ovulating. So that was last week's live, so you can take a look at last week. Today I'm going to be talking about an unknown factor in your cycle that can impact your moods, cause agitation, cause severe brain fog, maybe depression and anxiety. And it does occur with a lot of women, and it can be one of the issues with women particularly who have really bad PMS, but also women who have bad PMDD. This is why some women actually get relief from some of their symptoms when they take an antihistamine. So that's a huge clue that during your cycle your hormones are bouncing around and they're causing issues with your immune system, notably allergies, causing allergies. This is another reason that sometimes it can be tricky to identify food intolerances, because you know, times in your cycle you may not have this high histamine and you might be fine with some foods, and then mid-cycle you might suddenly flare up with a particular food, and that's why it can be so quite tricky to identify. But this can be driven through what's called sort of mast cell activation. Now this is a condition that's that really has come to light, particularly with mold illness and Lyme, and a lot of issues going along in that arena. But this can just affect women at a certain time in their cycle. Mast cells modulate the immune system, and they modulate histamine release, and it's a healthy reaction. So an example is if we get bitten by a mosquito, you get red, and it gets hot, and you've got this mast cell activation there, you've got the histamine activation, you've got everything bringing blood to that thing to sort of just heal and sort that reaction out. Now that can be a natural healthy reaction. The problem is when it's chronic and when it continues to act and it overreacts and it overreacts, and it happens time and time again, and your system doesn't really have a chance to reset. So signs of a mast cell activation, a histamine activation, might be redness, might be warmth in the skin, might be a little bit of swelling, and might be a little bit of itching, and that can be all normal. These cells are found mainly, and this is one of the connections that I want you to kind of think about. So these cells are found mainly on your skin, they're found in the lungs, they're found in your digestive system, and they're found in the urinary tract. So the fact of the matter is, knowing those systems, a good idea is to have a think about what does flare up in that later half of your cycle. So I know I've got some clients that get a tight chest. I know that I've got some clients that get recurrent UTIs, or what they think are UTIs. It's like a flare-up in the urinary system. Some get rashes on their skin. So it's good to have a think about these little things that do flare up in that later half of your cycle, because that will give you a good indication if there is an issue for you or if it is happening. It is really common for women to either get urinary tract issues, you know, that feeling that you need to go to the toilet but it's not a proper UTI, or you might go and get tested and it comes back negative, there's no bacteria, and that's an indication that there is something going on with your immune system, and it can be related to the cycle. So you know, symptoms can be swelling, we get hives, blood pressure can drop. See, that's another sign. Look out for that kind of drop in blood pressure, because a lot of women around their cycle do get that drop in blood pressure. Now blood pressure is quite sensitive, and if you're one of these people that suffer from low blood pressure, you know, if you're sitting down and you stand up quickly and you get the kind of dizziness, but a lot of women might get that during their cycle. Pregnant women get it also, and women going through menopause. So some women in the luteal phase of their cycle do replicate women going through menopause. So these all interact. It's the same hormones doing the same thing, just a different time in our life or a different time in our cycle. You might get difficulty breathing, also severe diarrhea, and that can be a sign for many women, you know, through their cycle, getting bouts of severe diarrhea. 1 minute it's fine, then you get to the luteal phase and suddenly you've got this diarrhea. Rapid heartbeat, rapid pulse, low blood pressure, like I said, and also some women do actually pass out. So all those are signs to kind of look out for and to give you some indication that something might be going on with your immune system. Also looking out for the skin, so the swelling, the hives, rosacea is one as well, redness, red rashes, and we've got the wheezing, chestiness, asthma might come at a certain time in your cycle. So look at these signs, look at what's going on through your cycle, look at how these physical symptoms might be affecting you. And especially if there are triggers, food and environmental triggers. So in terms of hormones, we know that mid-cycle is a difficult time for women with allergies and high histamine and mast cell activation. Women who are estrogen dominant do suffer as well. Women going through menopause, because although you might have estrogen dropping out, you've got low progesterone and you might have estrogen dominance in another type of estrogen that's very common. And then pregnancy is a biggie as well. So these are all the times that it can be quite sensitive for women. And what we do know and what studies do show is that estrogen actually induces the mast cell reaction. So estrogen causes this mast cell reaction, causes the degranulation, which then causes these cytotoxic elements to be released and histamine to be released. And another thing we do know is that progesterone suppresses histamine. So what I have found with some clients, I did have a client who had severe rosacea and she was having flare-ups, hive type flare-ups, and we did natural bioidentical progesterone cream and that seemed to help. So this progesterone and estrogen balance is very important when it comes to your flare-ups, mast cell reaction, histamine reaction, also allergies and also autoimmune conditions, because we do know that estrogen really dominates conditions that are autoimmune. So you've got your thyroid, MS type conditions, rheumatoid arthritis. These can all be supported and driven by hormones. So balancing out the hormones can also help that side of your immune system. So estrogen causes it to induce, progesterone suppresses. So ideally when you come to your mid-cycle and you're ovulating nicely and your progesterone is coming up high, one would hope that that would suppress the histamine. But the problem is in estrogen dominant women, that mid-cycle you have that luteinizing hormone spike, you have that estrogen spike, and it can really send the system out of whack. And so this is a telltale sign. It's these symptoms between ovulation and your period where they get exacerbated. So you will experience symptoms like fatigue, brain fog, anxiety, depression exacerbated, but coupled with the histamine type reactions as well. So if you get your PMDD symptoms, or you get your depression, or you get your anxiety, or you get your strong insomnia, coupled with allergies, coupled with more sensitivity to foods, coupled with more sensitivity to perfumes, to pollen in that half of your cycle, again, that is a huge clue that we're getting this mast cell activation and we're getting this elevated histamine in the body as well. And that's a big clue that you need more progesterone and you're most likely estrogen dominant. Histamine stimulates the ovaries as well. So this is the vicious cycle. This is the problem. Histamine is a neurotransmitter. It's an excitatory neurotransmitter. So too much histamine can cause anxiety. It can cause insomnia. It can cause ADD kind of symptoms. It can cause overthinking, ruminating thoughts. It's excitatory. So too much of that can cause that. Now what happens is histamine causes more estrogen excretion in your ovaries, and then estrogen leads to more histamine in your body. So you've got a vicious cycle. So what we want to essentially do is we want to break down histamine to reduce the reaction and to reduce the food for the ovaries producing estrogen, but we also need to deal with our progesterone and estrogen on a side as well. Now, along with these symptoms, and along with those symptoms, you might get other symptoms that are quite common with mast cell activation. These other symptoms can be physical symptoms such as bloating, diarrhea, pain. You might get more pain, maybe fibromyalgia type pain, but a very typical symptom of mast cell activation when it's really high, mast cell activation syndrome, is you get that kind of bone pain as well. you'll get severe brain fog. So I know sometimes, like, I get a little bit, you know, your brain's a little bit foggy in the morning, a little bit foggy time to time. But with this brain fog, it's severe brain fog. It's kind of like an all-day blanket. It's something you can't escape from. And then what you might find is your period comes and suddenly the veil has been lifted, that brain fog has been lifted. That's a huge sign as well. And you'll get the insomnia as well because you've got that high histamine, and you get the fatigue as well because you're not sleeping. This is why antihistamines can help you sleep, because they're suppressing that excitatory neurotransmitter. So those strong antihistamines, suppressing that neurotransmitter histamine and allowing your body to rest. Another sign is a racing mind. So with low serotonin, you get more the thinking. But with the high histamine, it's a racing mind. It's just the going from one thing to the other, going from one thing to the other. So if it feels like you suffer, or you know that you've had to take antihistamines in the past, or you know you feel better on antihistamines, or you know that your luteal phase is extremely severe and you do get that extreme brain fog or diarrhea, allergies, little allergy flare-ups. What did I used to get? I used to get sinus flare-ups in the luteal phase. I used to get those. And occasionally I would get this kind of, I don't know what it was I used to eat, or maybe it was red wine. I think it was red wine. I remember I would have red wine. I'd be fine sometimes with red wine, and then one day I would have it, it'd be a certain time in my cycle, and I would go like beetroot all down my neck here, and it would just be, and once, this was Christmas Day, probably about 5 years ago, I had a Campari and soda, I think, on Christmas Day, and my whole, I've got photos of it, my whole body was like blotchy red, these red blotches all over. They weren't itchy, but they're red blotches all over, and it's just really, really hot. That actually subsided. But you know, when I look back to my cycle, it's that same time in the cycle that causes that exact same time, and your body is just, the histamine is high and it's just reacting to certain things that you'd be okay with if you had it at a different time in your cycle. So this is why it can be confusing as well with foods and food intolerance. Now, the problem is, some of the foods that cause this kind of mast cell activation, this sensitivity to histamine, this overexertion of histamine, can be foods that are healthy for us. So this is the hard part. So we talk about eating dark chocolate, but dark chocolate's an inducer of histamine. Alcohol is a big one. And the thing about alcohol is women who have issues with their cycle, PMDD, PMS, anxiety and depression, rely on alcohol more in that luteal phase, and that can just exacerbate it. But alcohol induces histamine. Pickled foods, fermented foods like sauerkraut, which is so good for you, but it's best, if you know this is an issue for you, it's best to stay away from them this time in your cycle. Really mature cheeses, I mean, who here has had a really mature cheese and it kind of like makes your tongue feel a little bit cut sometimes? You just got that funny feeling on the tongue. So that's that mast cell activation locally in that kind of digestive system. Really interesting. Doesn't happen all the time, only sometimes. You need to look out for this because this can progress. You can get one little small sign, and if you don't take care of it, it can progress. Smoked meats can be a biggie. I mean, some smoked meats just don't work for me. My mouth just gets itchy straight away. Even a good quality, you know, grass-fed ham that's been smoked, it can flare my mouth up, so you have to be careful there. Also, which is a shame, legumes as well. Definitely soybeans, but legumes, nuts as well, walnuts and cashews. That's why a lot of people are sensitive to cashews, because they can bring up that histamine response. Oh, chocolate. Chocolate's a difficult one because chocolate. Again, this is the time in our cycle we're told dark chocolate's good for us, have the chocolate, it's got magnesium, it's got antioxidants, but the problem is if you've got an issue with histamine, an issue with mast cell activation, it can really flare it up this time in your cycle. So maybe save it till a different time in your cycle. When your period actually comes, might be the best time for you. Citric acid fruit, so lemon, and vinegar as well, acetic acid, so vinegar, gluten unfortunately, and then just all the pre-packaged foods, you know, with all the colorings and preservatives and all of those kind of things in. Another thing that will activate it are environmental factors. So any estrogens, so PBA from plastics, anything that's inducing estrogen, chemicals, external chemicals, and also external perfumes and air fresheners and things like that. You might actually find that time in your cycle, from your ovulation to your period, you might find you're more sensitive anyway to perfumes and cleaning products and scented candles. So just try and avoid it if it really does flare you up, because it's not just this physical symptom, it is causing an issue with your hormones. And then if you're getting the brain fog and the memory issues, it's causing an issue there. So just be aware of that. Those are the foods to stay away from. Now, I've talked about the foods to stay away from. So what I want to do is share with you, and I will share that, I've just got to get it ready, is a low histamine diet. I would advise, if you think this is an issue for you, I would experiment and maybe during your luteal phase have a lower histamine diet, and then take a few key nutrients that support to bring the histamine down. You know, an experiment. I can't, obviously, antihistamines aren't the best thing to be taking all the time, but if you know you feel better in the luteal phase on an antihistamine, then that's the biggest sign that you need to be working in other areas to bring your histamine down. And vitamin C is really good. So about 2,000 milligrams of vitamin C can actually help to break down the histamine. Now, if you're a client of mine, you know that I do advise kind of the vitamin C therapy. Now, I want to caveat this vitamin C with saying it's really good, but if it doesn't work for you, if you take vitamin C or you take a higher dose vitamin C and it's not working for you, listen to your body, never force anything. Vitamin C can increase oxalates, and so some people who are sensitive to oxalates just can't do vitamin C. Vitamin C can also cause more acid in the stomach, so if you feel like you're getting a little bit of reflux, you just stop. If you feel fabulous, continue. N-acetylcysteine, high dose N-acetylcysteine is wonderful for breaking down histamine. So you want to be taking between 1 and 2 grams. You take it for a few months and then you stop. N-acetylcysteine is not something that you take month after month after month ongoing, because sometimes you can get the opposite effect long term taking it. Quercetin, wonderful nutrient to take, and that breaks down histamine. Some people need more methylating factors. So we know on people that undermethylate, they might have issues with histamine. And who am I talking about? Yes, I'm talking about you, I'm sorry, the MTHFR folk. Sometimes you can be a little bit more sensitive to these foods. So taking methylating factors like B9, your activated folates, SAM-E can help you. SAM-E really helps me to an extent. I can take it for about 2 months and then I can't take it anymore. It starts to over-methylate me, so short period of time. Those are kind of my favorite nutrients. And 2 things that also do break down histamine, I forgot the name, activated sprouts like mung bean sprouts are really good at breaking histamine down. And extra virgin organic raw olive oil is good at breaking it down. Probiotics. Let's quickly talk about probiotics. If you know you have high histamine, if you know you have an issue with histamine and it's elevated, you do need to be careful with probiotics. So some probiotics do enhance histamine and cause more histamine in the body. So you want to be making sure you're looking and you're just taking, say, one that's breaking down histamine. So Lactobacillus rhamnosus and plantarum would be my go-tos, and I would just be really simple and I would just stick to that. Now the Metagenics do the eczema relief, which is actually the rhamnosus, and that's because it does help to support histamine and bring histamine down in the diet. So I would go with that probiotic, and then definitely take your fermented foods out in that later half of your cycle. Of course, this is for women that are just suffering in that luteal phase. This is another avenue to go down. If you've tried a few things in the luteal phase for your brain fog, for your anxiety, for your depression, for your mood swings, for your bloating or for your diarrhea in your luteal phase, and you're just finding nothing's working, this might just be a little bit of an avenue for you to explore. Explore the low histamine diet. I will share that with you. And just cut those foods out in your luteal phase and see how you feel. So I'd love to hear from you, any women that actually have issues with histamine during their cycle. Is it something you've thought about? Any women here that take antihistamines and get relief from their PMS or PMDD symptoms? I would be really interested to hear. So I hope you found that helpful. I will share the diet with you, and if you've got any questions, please pop them below, and I will see you next week at the same time. Bye. Have a great week.